What is an EEG? Electroencephalography, EEG, is a non-invasive diagnostic test to study the health and functioning of your child's brain by recording its electrical activity. During the procedure, small discs called electrodes are placed on your child's scalp, and the brain's electrical activity is recorded and displayed on a monitor in a pattern of wavy lines, or brain waves, called an electroencephalogram. Knowing what to expect can help you prepare your child adequately for this test. Why does my child need an EEG? The most common reason an EEG is performed is to assist in diagnosing epilepsy. It is also useful to characterize unusual movements in the awake and sleep states. Is the EEG safe for my child? The EEG test is painless and safe, without any side effects. The electrodes only pick up the electrical signals that are present and do not affect the child's brain or cause a seizure. Younger children can be sensitive to having their head touched and bandaged to keep the leads in place. Distraction and comfort from parents is helpful. Booking the study during nap time of the child is helpful. Types of EEG. Standard, routine EEG tests. Usually, a standard EEG test will be done at the clinic room. This study is normally performed in the awake patient. Sleep-deprived EEG tests. A sleep-deprived EEG test is performed when a child has had less sleep than usual the night before the study. When patients are sleep-deprived, there is a higher chance of detecting abnormal electrical activity if present. If sleep deprivation is a trigger for your child's seizure, discuss this with your doctor. Overnight video EEG study. This study is reserved for selected children. It is similar to a standard EEG, except that it records for more than 12 hours, with the ability to capture sleep-related events suspicious of a seizure. How do I prepare my child for an EEG? Wash your child's hair the night before. Avoid using any hair products or hair extensions which can affect the procedure, because they can interfere with the test. Give your child his or her medications as usual, unless otherwise specified by your doctor. If your child needs to be sleep deprived for the test, you will be advised by our neuroscientist regarding age-specific ways to achieve this. Ideally, we need your child to be fairly still during the recording. You will be advised on ways to relax or distract your child. Discuss with your doctor if your child has any special needs, or you think that he or she may not be able to cooperate with the procedure. What happens during an EEG? Parents stay with the child during the test. Your child will be asked to lie on a bed or sit in a chair. Infants are held by their parent on a chair and can be fed during the process or given a favorite toy to keep them calm. Your child's head will be measured, and the areas where the electrodes will be placed are marked and cleaned. The electrodes are placed on the scalp and held in place with a sticky paste and some light tape. After the electrodes have been placed, your child needs only to remain reasonably still while the brain's activity is recorded and monitored on a computer screen. A video is recorded in case an event occurs. This gives an accurate visual record in conjunction with the EEG recording. Children old enough to cooperate will be asked to open and close their eyes or do some deep breathing during the recording. The standard EEG test also involves photic stimulation, where your child will be asked to look at controlled flashing lights. How much time will the procedure take? A standard EEG usually takes about an hour to complete. A prolonged or sleep EEG will take longer. The actual time will vary depending on how long it takes your child to fall asleep. What happens after the EEG? Once the test is complete, all electrodes are removed from the scalp and the area cleaned. It is generally recommended that you wash your child's hair at home. There are no after effects from the EEG, and your child can carry on with normal activities immediately. Your doctor will receive the test results and discuss the findings with you. Key points to remember. EEG is completely safe and pain-free for your child. Wash your child's hair the night before. If sleep recording is required, follow the given instructions. A pediatric electroencephalogram, or EEG, is a painless, non-invasive test to monitor your child's brain activity to assess for any abnormalities. It is commonly performed to aid in diagnosing epilepsy.